Welcome to the PowerPoint presentation, Principles of Care Farming, designed to go with the video of the same name. Care farming, sometimes called social farming, is a therapeutic use of farming practices. As we've already heard in the What is Care Farming video and PowerPoint, there's really no such thing as a typical care farm. They vary in terms of type of farming, activities and environment, and can work with one or several different types of service user groups and different referral and commissioning agencies. So they vary, but what they all have in common is that all care farms deliver health or social or specialist educational care services for individuals from one or a range of vulnerable groups of people, and provide these farming related activities for people with a defined need, whether that's clinical, social or educational, and provide a bespoke structured care service on a regular basis for service users. And they're delivering these services for adults, young people and children. Care farming is a form of green care. So over the last 10 years, there really has been an increasing interest in using nature for health, and all sorts of different organisations have really recognised the role that nature can play on health and well-being. The value of nature for maintaining our mental health is particularly relevant at the moment. Being able to access nature has played an enormous part in helping people to get through the challenges of COVID-19. There are so many different nature-based initiatives. We're really lucky in the UK. These are being run by and for many different people. However, looking in from the outside, if you want to commission a nature-based intervention for a service user, or if you're looking at for somewhere to go for yourself, how do you know where to go? How do you choose which nature-based intervention? And as a result, those of us organisations working in the nature, health and wellbeing sector try to unify and deliver a clear message to commissioners. So this is the nature, health and wellbeing sector, encompassing a whole range of nature-based opportunities. In the outside everyday life circle, this highlights various situations in which an individual can engage with nature as part of their normal lifestyle, so sort of in everyday leisure or work activities. The middle circle, that we sort of title Health Promotion, outlines a variety of existing group and community projects which are specifically there to encourage people to benefit from doing things in nature, to become more active, to have more social contact, to increase well-being, that sort of thing. So where does care farming fit in? Care farming is a form of green care, sort of nature-based therapy and treatment interventions. And in order to help us communicate what it is that we do, in the nature, health and wellbeing sector, we adopted some sort of health language to further communicate with health and social care. So this is sort of more directive and consistent with emerging health prevention focused public health systems, and more recently we updated our language to align with the NHS model of personalised care. And again, in order to be able to communicate what we do to people in the education sector, we've adapted it further for education. So in the outside circle, it would include general messaging about food and farming, for example. The middle circle, school visits to farms to learn about food and farming, right through to the specialist educational alternative provision for young people with a special education need, behavioural issue, anxiety, that sort of thing. And essentially, this diagram is how we communicate the services we provide. And of course, many organisations deliver both types of service, both the commissioned referrals for individuals with a defined clinical, health or social need as part of a programme, or the more generalised, less formal approach for groups, one-off visits, volunteering, drop-in, that sort of thing. Often these approaches have very different referral mechanisms, funding, costs and support needs between the two approaches. And we really need to ensure we know which we're providing, and also to make sure that we know which the commissioner or the referrer wants. Care farming in the UK, origins. The origins of care farming in the UK is covered in a little bit more detail in the video, but essentially care farming has been around for a while. The term care farming originates from the Dutch words green care farming. The Dutch have been pioneering care farming for quite a long time now, many years. Other people like to use the term social farming. It's all the same sort of thing. Care farming has been around in the UK under the banner of care farming for 15 years or so, but some UK care farms have been delivering services for well over 30 years. Some care farms are set up by farmers or farmers' family members with an interest in sharing the benefits of being on a farm to a particular client group, as they have some experience with working with them, or have a child with a learning disability, or have worked in education or social care, for example. Other care farms have been set up by those essentially with no previous farming experience, but with a wealth of experience working in care, education or health, and who want to deliver services in nature and on a farm. Other care farms may be set up as a result of a partnership between people who have complementary skills or different experience in farming and care. There's so much variation. And through Growing Care Farming, we're trying to support new care farms to set up and also to support existing care farms to develop and grow. Care farming is good for people. The benefits of contact with nature. Through the published research, we now understand quite a lot about the benefits of contact with the natural environment, both for adults and for children. Nature contact can increase our physical and mental well-being. It can help reduce stress levels, help us with concentration. Nature also provides us with beautiful spaces for social interaction. In children, contact with nature and with other people can increase an aptitude for learning. And also unstructured play in nature can lead to a sense of freedom. This can in turn lead to independence and self-discovery, that sort of thing. And children are better able to cope with stresses. In fact, for all of us, spending time outside and developing a relationship, or what we call a connection to nature, can act as a buffer to help increase our resilience to future stresses. Research also tells us that spending time in nature not only has an immediate effect on our health and well-being, but it can also affect our health over our lifetimes. More recent studies on green care, including research into care farming and social and therapeutic horticulture, corroborates these findings too. Care farming and green care interventions can produce a wide range of psychological and social benefits. For example, a reduction in depression, stress and anxiety, whilst increasing self-esteem and quality of life. Some people find a sense of calm and safety spending time on a care farm. It can increase social inclusion and lead to a feeling of belonging, as well as the taking part in meaningful activity and a sense of personal achievement and self-confidence that comes with the learning of new skills. Care farms are all different, but they all have these key elements. Essentially, you get synergistic benefits from the interaction of these three key elements on a care farm and also in other green care contexts. So there are mental health benefits from natural surroundings that we've just talked about. There's also the benefits that come from the social context of care farms, people being part of a group, having a sense of belonging and sort of increased social inclusion, really. And then, of course, the other key element is the meaningful activities that participants carry out on the care farm, creating new skills, having a sense of achievement, responsibility and confidence. And, of course, there are additional physical health benefits too, being more active, feeling fitter, getting stronger, sleeping better. Also, people often learn more about food. Service users often share a meal on the farm, eating food that they may have grown or raised. So sort of increased nutritional benefits and lifestyle changes. Care farming is not only good for the people that access the service, but it's also good for those working and commissioning in health and social care and in specialist education. Health and social care in England has been in a period of change for a while. Simon Stevens proposed that the NHS needed to change from a factory model of care and repair to one that focuses on much wider individual and community engagement. And there's a drive to integrate health and social care. There's also social prescribing, a way of linking patients in primary care with sources of support within the community, thus providing GPs with a non-medical referral option that can operate alongside the existing treatments to improve health and well-being. Care farming can be a part of this, providing exactly the style of community-based non-clinical care which is ideal for social prescribing. There's also an upgrade in looking at health prevention and public health. So can nature-based interventions such as care farming be part of the solution to our health and social care needs, particularly during the lockdown as part of the COVID-19 restrictions? The value of contact with nature has really come to the fore, with many people using nature to help them cope through these challenging times. It's likely then that nature-based interventions such as care farming could play a really important role in the nation's recovery from COVID-19, a green recovery. So it really is, or really can be, nature to the rescue. So care farming, and also green care in general, has a number of implications for treatment for people with existing physical and mental health problems. The diagnosis is often left at the gate, and it stops people being categorised by their illness or challenges. People are simply all members of a team working to get things done, which can reduce our social isolation and make people feel much better. Care farming can provide a choice for those responsible for commissioning and referrals. It's another tool in the mental health toolbox to be used either on its own or alongside other approaches to help people feel better. For commissioners and referral agencies, care farming also offers multiple outcomes for service users. Care farming produces multiple outcomes simultaneously, so it's much wider than purely clinical outcomes. By design, it integrates health and social care, and it's also educational. Care farming can be cost effective, and more importantly, it's an enjoyable option. People want to go back. This observed effect on attendance and adherence levels could prove effective in encouraging uptake of treatment and, for example, could be especially successful in re-engaging men with mental health services, for example. So care farming is also good for agriculture. Care farming is a way of involving more people in farming, both in terms of service users as co-farmers, but also many care farms have strong ties and involvement with their local communities. Care farming can reduce isolation, not only for those who attend, but for farmers too. Care farming can offer an additional income stream to increase the viability of farms, without having to move away from agriculture. You need the farm to be able to care farm. Care farming is a superb example of multifunction agriculture, whereas as well as conventional farming, care farms are delivering public goods and services to help people increase their health and well-being. And care farming gives another example of how agriculture is beneficial for wider society. So this has been a taster. There are more details in the video and a chance to hear from care farmers and the service users themselves. Also check out our online training, starting with care farming and developing good practice in care farming. If you want to hear details about the number of care farms, who care farming is for and who refers, then check out our What is Care Farming page. We'll be uploading more resources all the time, research, films, case studies, etc. So keep an eye on our website, sign up to our newsletters and feel free to follow us on Twitter. Thank you.